Good evening. My name is Trevor Daly. I'm really proud to represent NAMI Los Angeles.
As many of you know, the National Alliance on Mental Illness Greater LA County, or NAMI GLAC as we refer to ourselves, is the leading countywide organization composed of grassroots-based chapters that promote wellness, recovery, equality, and dignity for individuals and families affected by mental illness and the community at large. We work to provide leadership in advocacy, education, support, and public awareness throughout Los Angeles County. We believe mental illness can be treated, and people living with mental illness can recover to live fulfilling lives.
Proposition 1 will expand mental health addiction services for tens of thousands of Californians each year, creating housing settings where over 11,000 Californians with severe mental health needs can live, recover, stabilize, and thrive, and provide funding for homelessness, mental health, and substance abuse issues are given the care that they truly deserve. Tonight, we're going to hear from our region's leaders and advocates about Proposition 1.
I would like to turn it over to Sheriff Luna. Sheriff Luna, thank you for being with us.
Too often, we see people with untreated mental illness and addiction issues that commit crimes and at times are arrested. In all cases, that shouldn't be happening. But unfortunately, with the lack of options and alternatives, this happens more than we would like to see. And for those of you who do not know, currently, the Los Angeles County Sheriff Department operates a jail system that has become the largest mental health institution in our country. 42% of our inmates are mentally ill, and it absolutely should not be this way at all. So that's where Proposition, I believe, will help. It'll help by allocating funding for mental health facilities so people with mental illness can get the treatment that they absolutely need, and hopefully, never end up in jail, or even worse, what we see a lot are repeat offenders. Proposition 1 would allow people with serious addiction issues to directly access services, something currently prohibited under existing law. Proposition 1 would make a big difference in our response to homelessness, as 2 out of 3 people experiencing homelessness unfortunately have active symptoms of some type of mental illness. At least that's been our experience. So at the end of the day, as I summarize, this is really about helping our neighbors. I believe it'll assist in reducing some crime, calls for service, and leave officers available for other things that we need to do by getting people the treatment that they need and keeping them from offending and or reoffending, which we see very often. Supervisor Hahn will be coming right after me. I'm very proud to work with her. I know she's very committed to this issue, and you'll be hearing from her next after she's introduced. Thank you very much.
I am Los Angeles County Supervisor Janice Hahn. It's great to be here with my sheriff, Robert Luna. You know, in last year's homeless count, 25% of people experiencing homelessness self-reported experiencing severe mental illness. 30% self-reported they had a substance use disorder. We know that the real number of people suffering serious mental health challenges and addiction on our streets is much higher than that. And that is a serious problem. And each of those people need help, but we haven't always been able to give them the help that they need. And a big part of the reason why is that we haven't had enough places where people can get off the streets and get the care and treatment that they need. Part of the problem is that we have been limited in how we can spend our mental health dollars. Under the current MHSA funding formula, counties do not have dedicated funding for housing. 76% of the MHSA funding is dedicated to community services and supports, and 50% of that is for full service partnerships. 19% is dedicated to prevention and early intervention, and 5% is for innovation programs, which frankly, we've struggled to spend. None of the buckets are for housing. These programs are worthy and important, but they are so much less effective without the housing component. The truth is, it is nearly impossible for a person to get well when they are living in a tent outside, struggling to stay warm or get enough food or water. Studies have shown that mental health and substance use worsens or maybe is even triggered by living on the streets for long periods of time. Proposition 1 aims to solve that problem. It would change the MHSA funding formula so that 30% is for housing, 35% is for full service partnerships, and 35% is for behavioral health services and supports. And under this formula, LA County could finally spend these important mental health dollars on housing. It would mean focusing these precious resources on the people with the deepest mental health needs and addiction issues. Proposition 1 would also include a $6.4 billion bond so that we could build thousands of more places up and down the state of California where we could get Californians with the most severe mental health needs, places they can live and get the care and treatment they need. I know there's concerns about what will happen to programs that might lose funding under this new formula, but our current strategy, I believe, is falling short. When someone is suffering from a mental illness and is living on the streets, it makes their path to recovery that much harder. And we know that having access to housing is crucial for mental health treatment to be successful. And for too long, we have not had enough treatment beds for those suffering from severe mental illness in LA County. And we've not been able to spend our mental health dollars on housing. Prop 1 aims to address both of those challenges. So thank you again, NAMI, for holding this town hall. And thank you, Daryl.
Thank you, Janice. Thank you to NAMI. NAMI has always been on the forefront of this movement, and it is a movement, the mental health movement. Over the course of time, what is so gratifying about the moment we sit in today, in addition to the opportunity to pass Proposition 1, is that mental health has now risen as a top-tier public health and public policy priority because, for many reasons, homelessness, COVID, the suffering of our kids, but also the positive evolution of attitudes in our society that now there is no shame and there should never be shame. I think Supervisor Hahn did a great job summarizing what Proposition 1 does. And I think what I can add here is a little historic perspective with, I hope, some credibility, because I am proudly the lead author of the Mental Health Services Act. The original intent was to focus those dollars on homelessness, chronic homelessness, and helping the sickest of the sick around the issues of mental health and coexisting substance abuse disorders as well. And over that 2-decade period, while many people have been helped, that focus has not been the top priority. And until Governor Newsom came along, no governor, and they were great governors in my opinion, chose to put a statewide lens on what we wanted that money to be spent on. And so Prop 1 gets us closer to the fulfillment of that original promise from 1967, when the state passed the Lanterman-Petra-Short Act, and would come closer to fulfilling the original intent of the Mental Health Services Act, Proposition 63 in 2004, by requiring, it's really upfront accountability, by requiring, as Supervisor Hahn said, that 30% of the money every year be spent on housing support for people, because we can't help people with severe mental illness, as she said, living on a riverbank or living in a tent encampment. 35% for wraparound services, the coin of the realm known as full service partnership, whatever it takes. And the remainder of the money for other supports, including cutting edge prevention and early intervention. Now, the biggest concern, I'm going to answer one of your questions, Trevor, right up front here, because one of the biggest concerns is, and Supervisor Hahn alluded to it, well, what about the existing programs? A lot of good clinic programs, a lot of things that are helping people maybe with more moderate mental health conditions. Well, here's the good news. the landscape around mental health, the fiscal landscape has changed quite a bit. And so while there's some concern, there's also a tremendous opportunity to take these two important funding sources. MHSA, BHSA will be about $3 billion a year. CalAIM, bring in the private health plans as well, and create an integrated system of care so that there's something for everybody along the spectrum. So I'm a big proponent of Prop 1. I think it is consistent with the original intent of the Mental Health Services Act and gets at chronic homelessness in a way we've never been able to before. And by the way, adding a $6.3 billion bond so that we create thousands of additional beds is going to help enormously on top of the 30% set aside for housing. The only way Proposition 1 loses is if people don't come out to vote.
What happens if it doesn't pass?
If this does not pass, public officials and the heroic nonprofits and the great teams out there will not be able to answer the question, where do I bring somebody who's willing to accept the help or now under a care court, who might even be required in appropriate circumstances to accept the help? Where do I take them to? We will lose a $6.3 billion bond if this does not pass, and the ability to fund thousands of additional beds, and we will lose that accountability around the original Mental Health Services Act. The money won't go away. It will still remain on the books, but that focus and that accountability. So we must pass Proposition 1.
Proposition 1 has the ability to transform our mental and behavioral health system in a way that we haven't seen in decades. It's on the ballot now, so make sure you vote. And thank you all for joining us, and I hope you have a wonderful rest of your evening.